You're listening to Systemic Error Podcast. The failure was designed.
Trump unleashes $1 billion in retribution, based on an article by The Conversation. Medicaid fraud as a cover story for political punishment. Power, not paperwork. On July 21, 2026, the Trump administration withheld more than $1 billion in federal healthcare funding from California and Minnesota, claiming the states had not supplied enough documentation for disputed claims tied to Medicaid services. That is the headline fact. The political fact is sharper. The federal government chose coercion over ordinary audit practice, and it chose Democratic-led states as the target. This is not neutral oversight. Medicaid officials normally work with states through a slow, joint audit process when they suspect fraud. The administration instead reached for a blunt instrument. Freeze the money first, demand compliance later, and call it integrity. Fraud is alibi. Yes, Medicaid fraud exists. Yes, providers sometimes bill for services that were never delivered or were unnecessary. None of that is in dispute. The dispute is what the administration is doing with that reality. It is using real abuse as a pretext to attack the program itself. The goal is not simply to catch bad actors. It is to blur the line between enforcement and sabotage, then sell the sabotage as prudence. That is what the Crush initiative amounts to in practice. A policy of padlocking the jar and starving the people who depend on what is inside. Who pays? The money being withheld is not abstract federal bookkeeping. It funds in-home care, nursing home care, disability services, children's health care, and insurance for low-income residents. When the administration cuts Medicaid, the damage does not fall on fictional fraudsters. It falls on patients' caregivers and state systems already under strain. The article's own numbers show the scale of the assault. The July 2025 tax and spending law is projected to strip nearly $1 trillion from Medicaid over a decade, and researchers estimate almost 12 million people could become uninsured by 2034 because of those changes. By mid-2026, more than 3 million people had already lost coverage from Republican changes to the Affordable Care Act. This is not isolated enforcement. It is a broader dismantling of the safety net. The old trick updated. The political script is old. For decades, American leaders have used fraud and abuse to make public benefits look suspicious, wasteful, and morally tainted. Sometimes the target has been providers. Often it has been recipients. Either way, the narrative does the same work. It turns a social right into a moral liability. That matters because the rhetoric is never just about bad billing practices. It becomes a vehicle for discrediting government capacity itself, especially in democratic states and especially when the beneficiaries are poor, disabled, or otherwise easy for conservative politics to portray as undeserving. The administration is not merely policing Medicaid. It is staging a political argument that public aid inevitably breeds dishonesty. The real decision. The governors of California and Minnesota called the move politically motivated, and the reporting supports that conclusion. The administration made a deliberate choice to withhold funds rather than use ordinary oversight channels. Health Secretary Robert F. Kennedy Jr., Vice President J.D. Vance, and CMS Administrator Mame et Oz were not describing a technical breakdown. They were launching a campaign. That campaign depends on a familiar reversal. The stronger side frames punishment as reform, and the weaker side is told to prove its innocence while losing the money it needs to function. This is how democratic institutions are worn down from the inside. The target is not just Medicaid dollars. It is the idea that federal benefits are a legitimate public obligation at all. The pattern. The deeper pattern is authoritarian in miniature. Manufacture distrust, select vulnerable institutions to punish, and call the damage accountability. Medicaid is being used as a test case because it serves millions of people, relies on state administration, and can be made to look suspicious to voters already primed to distrust government. The point is not to clean up the program. The point is to delegitimize it. Once that logic is normalized, the administrative state becomes a weapon against the public it exists to serve. That is the real fraud here. Not the claim form, but the pretense that starving a program is the same thing as governing it. You've been listening to Systemic Error. Thanks to Alternet for today's article. With the automated voice of Labor's our thanks for listening.